More than 56% of homes in outbreak. The Ford government held a news conference today about long-term care homes, but announced no urgent action to address the rise in cases or deaths. Nicole Martin has that story.
It was the first we were seeing of newly appointed long-term care minister Paul Calandra, who outlined his three-point plan.
Improving staffing and care, strengthening accountability, enforcement and transparency, and building modern, safe, comfortable homes for seniors.
We are hearing nothing in terms of the investments that we need to actually support those residents living right now in these facilities and the staff who are desperately burnt out, working in terrible conditions to try to support them.
Long-term care researcher and advocate Vivian Stamatopoulos and essential caregiver Joanne Beggs, who looks after her 94-year-old father at a home in Oakville, say they watched the news conference in disgust today.
It felt like a slap in the face that they are choosing to focus on future builds and to give themselves pats on the back. And in the meantime, they are ignoring the current state of suffering.
They expected Calandra to answer questions about the current long-term care crisis, but instead a range of other topics were discussed.
There was no mention of the Omicron crisis during this entire press conference. All they did was talk about how they built another, 323-bed warehouse, for future residents.
It's part of the Ford government's plan to create 30,000 beds by 2028.
We listened to the call for more long-term care beds to care for our most vulnerable.
Who is going to work in them? Who is going to work in these facilities when we have record staffing shortages?
Joanne Beggs says these new beds will not help her father Bob and thousands of other seniors who are struggling tonight.
There's nothing like watching your parent walking around, medicated for sleep, walking around, in very unsafe conditions, an alarm going off for a staff person to come. And because they're 1 to 28 at night, it can take 30 minutes, 40 minutes, and just watching on a camera and just hoping that they don't fall. It's awful.
In Hamilton, Heritage Green Nursing Home has the highest number of cases with 110. 61 of them are residents living here. Those residents are put in isolation. In Bob's case, he had to stay in his room for over a month. Stamatopoulos says right now there are more homes in outbreak than at any point in the pandemic.
Alexander Place here in Waterdown is one of 20 active outbreaks among long-term care and retirement homes in the city of Hamilton. Across the province, there are 5,400 residents and staff that are currently infected with COVID-19. And last month, in the month of January, there were 243 senior residents who lost their lives.